Let's start. I think we think bringing this aspect to our practice is such an important thing. As President and the Director of Quality rightly said, when you talk about the quality, satisfaction matters a lot. So this is where you bring the satisfaction to our patient's mind. And of course, we get our achieve professional satisfaction. This will be the outline of my talk. What is humane care? It's nothing new. It's actually bringing humaneness to the bedside. You just meet another human being, of course, in the ward. I mean, we meet each other in various places, but if we take the same concept to our ward, it's the same thing. I will try to elaborate on this a bit more. For that, let's try to understand to see who a patient is. When I ask from the medical students who come to the clinical appointment or from the registrars, this is the most common answer that I get. A person with an illness who is receiving medical care, which is true, isn't it? But if you search this term, the patient, how it is derived, this is how it was. It's coming from a Latin verb called pati. It means suffer. So patients are ironically sufferers. So what are they suffering from? Obviously they are suffering from an illness, pathology or disease, what you may call it. And I think they are suffering from many more other stuff like pain, fears and anxieties, maybe social issues, financial issues, and of course they have their own ideas, concerns and expectations about their illness. That's another quality, another aspect of being a patient. And of course some of them have knowledge also about, knowledge and experience about the illness. I would try to explain a few of those about fears and anxiety. This is what the physician charter explains. Practice of medicine involves investigation and treatment of physical and mental conditions that are often fraught with fear, anxiety and doubt. Many life-saving decisions are made in the face of uncertainty. So it's very common for people to have anxiety and fear. What are they afraid of? What are they anxious about? They are anxious about the illness and its outcomes and what would happen to me? Would I be able to live? Would I lose my part of organ or whatever? And maybe the investigations, blood tests, lumbar puncture, scans, you name it. They are only words for us, but they have to face the situation. And of course, the system of the hospital. It's a very strange system. There are so many rulers. They need to be abided by the rule of every person, starting from the healthcare assistant to the consultant. So they may be anxious. Is that all? Can I have a head count on this? Are patients afraid or anxious about the health stuff? Yes or no? Who says yes? Of course. So as you said, so that's another factor which brings the anxiety or fear for patients, apart from the other things that we discuss. How about this? Do patients have knowledge about their illness? Yes or no? Yes? Who says no? Well, I will tell you a story, then you can decide on that. This is an incident happened about 15 years ago. A lady came with swollen face, swollen lips, difficulty in breathing around 12 o'clock midnight to the ward. And she has asked for FFP from the house officer. Doctor, you can see my face is swollen, I can't breathe. Can you please prescribe me some FFP? So house officer said, well, I can see that you have an allergy. I have never given FFP for a person with allergy. So I'll give you some hydrocortisone. No, doctor, please give me some FFP, otherwise I would die. Miss, given hydrocortisone, then hydrocortisone. So she was not given any chance to speak up. She was given hydrocortisone. What happened? She arrested herself after about 2-3 minutes, and then we were summoned. Of course, we were not able to resuscitate her. So what was this disease? What is the disease? Can anybody tell what the disease is? Yes, it's C1 esterase deficiency, isn't it? So when you have a lot of histamine which cannot be cleared because of this lack of enzyme, I mean, no point in giving hydrocortisone or adrenaline. It's the FFP that you need to give. So not knowing this disease, was it a crime by a house officer? Well, it's not a crime, is it? I mean, if you ask from entire doctor population in this country, there will be 10% of people who comes up with the answer. But what was the crime committed is not to respect her concerns and knowledge. And she has not given a safe space to talk. So, therefore, I believe the patients, I mean, it's good that if we can believe that the patients have some amount of knowledge and experience behind their illness, which we can make use for their own advantage. So patient, ladies and gentlemen, is not a person merely with an illness alone. Coming to another aspect, this is Dalai Lama who said, whether we like it or not, we all have been born to this world as part of one great human family. By that sense, we are fellow human beings, aren't we? This is what Journal of Pediatric Hematology says. A health professional needs to respect his patient. He needs to understand that in front of him there's a human being who has opinions, points of view and feelings. So patient is not merely a person with an illness. Patient is fellow human being to start with, who suffers from a lot of things like illness, pain, fears, anxiety and all, and has knowledge and has ideas, concerns and expectations. So this, we believe, the expert committee of human care in SLCIM believes this is the definition for a patient. Not only they have illness, they bring a lot of other things with them. So if they are a fellow human being, are we cherishing this unique moment to meeting up with one of them? I mean, we cherish the moments that we meet up with another friend in the road or anywhere. So are we doing that? Well, this is what JAMA says. Patients are treated only as carriers of disease, and medical attention has shifted from the patient to the abstracted disease carried by them. Sir William Osler said, the good physician treats the disease, the great physician cares the patient who has the disease. So I think Sir William Osler has had this overall picture in his mind and this quote. What is care and what is treatment? So care is what we do for the illness. Like one said, thrombolysis for the stroke. That is care. That is treatment. Care means when you address all those facets that we describe, that's the care, the provision of what is necessary for the health, welfare, maintenance of and protection of someone or something. So that is care. So I think we better become carers, we better practice these concepts. Coming to the next subtopic, who is a physician to a patient? I mean, if we can see through the patient's eyes, whom that they want from us. This is what World Health Forum says. Surprisingly, few patients seems to worry about the technical competence of physicians. What they worry about is their physician's ability to understand the patient as a person and provide the right guidance during their journey through the illness. Technical competencies are very much important. That's true. But they expect them to be guided by you as a person, not as an illness. That's what it says. The solution should be sought within the medical profession itself. Right, guys, are you physician in this caliber? Well, most physicians are skilled at collecting medical information important for clinical diagnosis. However, they obtain less information about the attitudes, beliefs, concerns patients have about their illness. So it goes on. Without knowing those, physicians may find themselves and their patients frustrated by misunderstandings and differing agendas. So you encounter a lot of problems. This might be a reason. So what do they expect from their physicians? The ability to understand the patient as a person and provide the right guidance during their journey through the illness that we need to understand. For you to guide them, you need to have two important qualities. What are they? One thing is empathy, the other one is compassion. So these two concepts will be spoken about my colleagues in their lectures. Coming to the next subtopic, relationship with the patients. What are the types of relationships that you can maintain? There are two types. Firstly, it's factual or more formal relationship, or it could be humane or more personal relationship. Factual relationship, and you are equal partners of a legal contract, and which jeopardizes the prioritization of patients' interest actually, and implies defensiveness, isn't it? And you can see this more often when you go abroad, when you go to a foreign country and practice. You can see this principle in action very commonly. And when it comes to humane or more personal relationship, physicians adopts eccentricist commitment while respecting the patient's unique concerns and enabling autonomous decision making. So what do you practice in the first place in the bedside? Is it human-to-human relationship or more personal relationship or doctor-patient relationship? Can we have head count? Number one or number two? So I believe it has to be, first we practice the human-to-human relationship. You become a friend of the patient and then you go on from there onwards. Right. First, human-to-human relationship. How to do that? Accepting the patient, smiling, trying to help, trying to share, coming to the same level, kind of. And show the respect. Doctor-to-patient relationship, you need to listen for their concerns. Of course, have an habit to acknowledge their symptoms. Try to share what they come for. And another important aspect, are patients helpless? Can we have head count? Yes or no? Yes? No? Well, what do you mean by helpless? Helpless is that you don't have any help at all. Let's say that your water bottle finishes when you are in a desert. Nobody could bring you water, isn't it? So nothing can be done. If you are encircled by a group of terrorists and your leg gets chopped off by a Johnny Batta, what can you do? You can apply a tourniquet, that's it. So you are helpless. But is it the situation that our patients are in? No, they have very organized help actually. They have hospitals, they have doctors, they have staff, they have ambulances, and everything is governed and maintained by they are contributing for that also. But having this concept in operation has done few things. One thing is that there's a big gap in Sri Lanka among patients and between patients and healthcare staff. There's a huge gap. So because of this gap, so many things happen, and you may not do the best thing needed to that particular point. Your brain might get satisfied with whatever you do, might not be the best thing. So I think it's a myth that we carry that the patients are helpless. But if we believe that they have rights, then we can bring more humaneness to the bedside. So ladies and gentlemen, the take-home message would be patients are fellow human beings, as we discussed. They have so many sufferers other than illness, as we discussed. And they have ideas, concerns, expectations. They have knowledge also. We need to pay respect for that. And need to care our fellow human beings with the illness. It's not the abstracted disease that we need to care. The diseases, the pathologies might be similar to the person to person. But the patients are different because of the other factors. Their social issues, financial issues, how they think, their concerns. So patients are unique. You often heard when you go in the ward round, say එක SDH එකක්. say එක MI එකක්. Isn't it? Is that right? No, it's not right. So there are patients with illnesses. And in an empathic and compassionate manner, which will be discussed in next 2 lectures. And we need to prioritize their needs than ours. So that is the best definition for a professional. Professional is a person who prioritizes his or her client's needs above his or her own. We have our requirements, patients have their requirements. At the time of contact, we need to prioritize their requirements than ours. For you to do that, you need to know these principles. Of course, you need to be empathic and compassionate as well. I think if we do this, we can bring more humaneness to our practice, our care, and the satisfaction that they get will be more, so as we also get a professional satisfaction. Thank you so much. Please join with SLCIM, an expert committee in humane care, to bring this important aspect to our patient care. Thank you very much.